Joining us now is Dr. Tristan LeTourneau. And Doctor, I am a firm believer in chiropractic care.
Yeah.
It's done wonders for my family, but we're focusing on neuropathy today.
Correct.
Tell us about what is even neuropathy? What is this?
Yeah, it's a great question. Peripheral neuropathy is a condition of nerve damage that affects the peripheral nerves, which reside in the arms, hands, legs, and feet.
Okay.
So you're really going to feel this. What are some of the symptoms that you're going to feel if you have neuropathy?
Yeah, there's a ton of symptoms that come with it. The most prevalent are some form of numbness and tingling that affects the hands or feet, burning, pain, muscle weakness or cramping, overall increased sensitivity. Some folks get electric shock-like sensations. And,
wow.
Yeah, potentially poor coordination and poor balance.
All the time or just intermittently?
It truly varies depending on the case. Most of them are feeling some degree of those daily.
Okay, when I think about neuropathy, I think about maybe this is something that can happen to you as you get older. How does this even develop? Is it an injury? Is it age?
Yeah, spot on. So there's over 100 different causes that cause neuropathy. Some of the most common, though, are diabetes, traumatic injuries, infections, metabolic disorders, or some inherited causes, and then even from exposure to toxins like chemotherapy.
I bet as a chiropractor, people come to you and they think it's a pinched nerve.
Right.
Or they have no idea,
yeah,
and being able to give them a diagnosis, I bet, is just a relief.
Absolutely. And doing my board certification in neuropathy, we found that over 60% of folks have some sort of a structural component related to it.
Interesting.
Some people might just want medication for this, but you guys don't do it that way.
No, we pride ourselves on not being a pill mill, meaning that we don't use any drugs, injections, or surgical interventions, rather focusing on regenerating the nerves and blood vessels that are dead or dying.
Okay, so you're doing that with adjustments, I would guess, right?
Some folks, yes. If there's a structural component involved, we do our due diligence to see what's going on in that realm. Otherwise, a lot of our patients are able to do the therapies and treatments from the comfort of their own home.
Okay, so
They don't have to leave.
Yeah, how does that even work? How are you coming to them?
Yeah, no, great question. So typically, depending on what nerves are affected, meaning the larger small fibers, we will tell them, hey, this is the protocol we need to utilize. We're currently using low-level light therapy and nerve conduction units that focus on what's called angiogenesis, or the formation of new blood vessels, but then also re-educating those nerves so that they start to pick up the sensations from a sensory and motor standpoint.
So you're repairing it, essentially.
Yeah, exactly, yep. If you think about like a tree, if it doesn't have, or a plant, if it doesn't have proper soil, oxygen, and nutrients, we focus on that.
So how long has if you feel like you have this burning, it's not just a one-time thing. This is an ongoing thing. Then, if you think you have this, how long has it probably been going on for you?
I've seen people from anywhere from 6 months up to 20, 30, 40 years that they've been dealing with it. So the key is getting on top of it as quickly as possible.
Yeah, I was just going to ask, can neuropathy kind of reverse on its own, or are treatments like this always needed?
Yeah, so our patients, depending on how they're responding, we'll always follow up with them from a sensory standpoint. But we always tell people, hey, if we get to a point where you don't have any symptoms, just stay proactive and continue doing whatever you're doing that we recommended to get you.
Okay,
that makes sense.
So tingling in the hands or feet, muscle weakness, numbness, that's a big one?
Absolutely, yeah.
Okay.
The pins and needle type feeling.
I felt that before.
Only when my foot's asleep do I feel it.
Yeah,
so is it that kind of thing?
Yes, exactly, but it's regardless of position, it's ongoing each day.
That's crippling.
man,
Yeah, that
that'd
would
be
just feel so tough.
Okay, so obviously not everyone that walks in your door that has these symptoms, it is neuropathy. So you're doing a consultation. You're going to consult them wholly and figure out what's going on.
Yep, exactly. So we'll do a full consultation, history, exam, and report of findings. Our neuropathy special is extremely thorough so that we can identify and create a treatment plan for each individual patient. And through doing so, we'll be able to tell you the exact percentage of sensory loss in your hands and feet.
And so once you get that consultation from then, some people can do this just at home over a Zoom call or whatever.
Exactly. We'll be able to monitor through it through our online patient portal and be in direct communication with them throughout the whole process.
I like that there is a specific, he is specifically talking about neuropathy, and that's something that you have studied.
Yes,
you're trained in that.
Yeah.
Okay, really
You're the guy.
interesting.
Yes, ma'am.
You're the
Yes,
guy.
sir.
You're the guy they're going to see.
And he calls me ma'am, which is so nice.
Yeah, my grandparents' parents, if I didn't, they'd come down here themselves.
See, they're watching. We know. He already told us. So
Thank you,
look.
doctor. Really,
Yes.
really interesting stuff. We appreciate it.